Should be recording.
Perfect. Yep, it says it's being recorded. Welcome to everyone joining. Thank you so much for your time today. And as you're coming in, if you just want to share your name and organization in the chat box, we would love that. Know where you're coming from, see who we've got with us today. I see Natalie has a raised hand. Natalie, do you want to put something in the chat? Thank you, folks, for sharing where you're from. I see a lot of great people from around North Carolina. And for everyone who's concerned, we are recording this webinar, so you'll have access to it afterwards along with the slides. Beautiful. We'll get started in just 1 minute. Good afternoon again to everyone who has joined. While you join, please just put your name and organization in the chat box. We'd love to see who's joining us today. All right, folks, we have quite a few people in here, so we're going to go ahead and get started. Welcome everyone for joining today. We are going to be talking about the essentials for a childhood updated action plan called Building Resilience and Promoting Well-Being. Can everybody hear me okay? Perfect. All right. So before we get started, I would like to go ahead and thank the CDC for their funding of this initiative. They've done a lot of really great work promoting childhood well-being, and we are a lucky recipient of that. So I'm going to go ahead and take us through the agenda quickly. We're going to start with welcome and introductions. We're going to do, speaking of introductions, I'm Ivana Maskevich, Research Specialist with NCIOM. Opening remarks from Ingrid Busada will follow. We'll have some opening remarks from Meredith Archie. We'll provide an overview of the Essentials for Childhood updated reports. We'll have a great expert panel discussion with Jenna Barnes, Amy Cubbage, and Kella Hatcher. We'll have a few minutes for question and answer, and then we'll have closing and next steps. Just a couple of housekeeping notes. Please put your questions in the Q&A box, which should be enabled. If it's not, Brady will help me fix that. Thank you, Brady. And then please use the chat to communicate with other participants. We would love to see a few folks having cross conversation, connecting, and doing other work with each other as well, because a lot of this work we've discovered is siloed. So the more we can connect anyone that we can, the better we can do this work. And with that, I'm going to turn it over to Ayana Simon, who is the Associate Director of NCIOM, and she's going to go ahead and give us an introduction to the North Carolina Institute of Medicine.
Thank you, Ivana, and I'm so glad to be here and with so many people on. So I just want to do a brief overview of who we are as the North Carolina Institute of Medicine. Again, my name is Ayana Simon. I have the pleasure of serving as the Associate Director, and have been here for a couple months now since December. So I'm enjoying it. So we were chartered in 1983 by the General Assembly. Your screen shows the four areas in which we were tasked to fulfill our work. Number one being the largest, which is and most vague, which is to be concerned with the health of the people of North Carolina. And we've done that now for over 40 years. And the work that you're going to hear about later really focuses on how we're studying some health matters, responding to some of the gaps that we're seeing in our state, and then requests from outside sources. So those are the four areas in which we really focus our work. Next slide, please. So how was this done? So we are looking at the landscape of North Carolina, hearing what our stakeholders are saying, our community members are saying as some of the pressing health topics, what might be some insights and solutions, and we bring influencers together in that larger circle in the middle for evidence-based consensus. That is done in a number of ways, whether that's action teams, whether that is our newsletter that we present, our task force work, our update committees, which is what we're representing here. And then we disseminate those recommendations into the broader public. Our target really is for these recommendations, our issue briefs, and any of our communication to really improve long-term health of the citizens of North Carolina. Next slide, please. And so, as it indicated of our process, sometimes we have requests from a number of different people, whether that is the North Carolina General Assembly, sometimes we are written into bills, or just tasked with doing some investigative work for things for legislation that's upcoming, state departments and divisions, and then some private funding from our philanthropic partners around things that they would like to invest in as well. Next slide. Just a little bit more about our funding sources. You heard Ivana talk about this work being funded through the CDC. We are oftentimes tasked with identifying solutions for specific requests, and that oftentimes comes via grants. And then we also have some private philanthropy, those mentioned on the screen, Blue Cross Blue Shield Foundation, AHEC, Kate B. Reynolds, and the Duke Endowment are some of examples of our funding sources. So impact, which is the most important and the reason why we're here. We want to make recommendations that we know that will have a positive impact. And we publish those in a number of ways. Like I said, we have our task force reports, our action team updates, issue briefs, and then we also publish the North Carolina Medical Journal as well. And so we look at some of these statistics on how do we know what we're doing. We're conveners of the work, not necessarily implementers of the work, but we do keep track of where our task force recommendations work, where they're working, how they're implemented, whether partially or fully. We look at things like this. How many people are coming to some of our webinars and in-person events where we're speaking about our topics that we've discussed or our publications, web analytics, and qualitative comments. And then we do like this work here. We sometimes are able to do an update to previous work. So this work happened back in 2013, and this update committee started last year. So this is where we, for the most part, look at the success of our work is how are we bringing people together to address these issues, and what does that look like as far as where our recommendations land, what updates are needed, and the interest of individuals in our topics. So that's a little bit about the North Carolina Institute of Medicine, and I'll turn it back to you, Ivana.
Thank you, Ingrid. Thank you, Ayana. That was perfect. And now I'm going to turn it over to Ingrid to talk a little bit about the partnership between DHHS Division of Public Health and NCIOM. Thank you, Ingrid.
Thanks, Ivana, and good afternoon, everyone. Before I jump into those partnerships, I do want to just talk briefly about what Essentials for Childhood is. As mentioned already, this is a CDC-funded program, and it has four main components. And the first one really undergirds all of the work that we're doing, and that is to build a state-level surveillance infrastructure to collect, analyze, and use data on ACEs or adverse childhood experiences, positive childhood experiences, as well as social drivers of health. We are also implementing data-driven, evidence-based prevention strategies in order to prevent those ACEs as well as promote positive childhood experiences. We are tasked with developing an ACEs Prevention State Action Plan, which is what this report serves as. It is our updated state action plan. And finally, we are using the data that we are monitoring, collecting, analyzing. We're using that to inform action. And that means that we're using it to make changes when necessary to some of the strategies that we're already doing, possibly adapting some strategies, also adding new ones if the context changes. And then a really important part of monitoring that data is to look for changes. And so if we see a change, a spike, for example, in in one of the adverse childhood experiences, or we see a worrisome trend, then we would use that to communicate out, whether that is to a health department or county agencies, to Head Start, et cetera, or to populations that may be experiencing that change in the data. And we would then try to link them with some resources. Next slide. So CDC has funded Essentials for Childhood since 2013, and we are currently in our third five-year funding cycle. We are at the end of year 2 of that five-year cycle. The money does come to DHHS, to the Division of Public Health, and I am housed at the Injury and Violence Prevention Branch in the Division of Public Health, and we are the folks who manage it at the state level. Most of the funding does go back out, though. It doesn't stay in DPH. And North Carolina has been incredibly lucky in that we have been continuously funded since the Essentials program was established in 2013. We do take the money that we have and contract out to several other organizations, including UNC, the School of Public Health there, and the Injury Prevention Research Center to provide some evaluation services. And they're also the ones who are tasked with developing that data and surveillance infrastructure with us and with the epidemiologists in our injury branch. Since 2016, the Institute of Medicine has served a really key role as the backbone organization. They help us with contract management, with partners. They facilitate meetings such as this and the meeting that developed the updated action plan, as well as other types of administrative support. The other contracts that are included under NCIOM are the 4 partners that have been with Essentials for a number of years. Those include NC Child, the Positive Childhood Alliance, NC, which was formerly known as Prevent Child Abuse North Carolina, Moms Rising, as well as the Early Childhood Foundation. And now I am going to turn it over to Meredith.
Thank you, Ingrid. And then we'll hear from Meredith Archie, President of the NC Chamber Foundation.
Great. Good afternoon, and thank you, Ivana. I'm honored to join you today and proud to have served as the co-chair of the Essentials for Childhood Task Force. At the NC Chamber Foundation, we work every day to provide research and data that informs policies and strategies to support a thriving economy. And we're increasingly clear-eyed about what it takes to achieve that goal. The strength of North Carolina's workforce today and tomorrow is directly tied to the well-being of our children and our families. That's why this work matters. The systems that support children, from childcare, healthcare, early learning, housing, and more, are also economic systems. And when they function well, parents can work, businesses can grow, and communities can prosper. And when they break down, as we've seen with the childcare shortage crisis, the ripple effects are also felt across the economy. Workers leave the labor force, employers face instability and rising costs, and ultimately, our state's competitiveness suffers. This updated Essentials for Childhood report offers a roadmap to help reverse those trends. The 15 recommendations and 43 strategies it outlines are rooted in evidence and practicality. They also reflect that no single sector, government, business, philanthropy, or community can go it alone. Lasting change will require shared responsibility and sustained collaboration. For the business community, this report is an invitation and a call to action. It outlines real opportunities for business leaders to align their goals with long-term outcomes for their employees and their families. Whether it's advocating for childcare solutions, supporting workplace flexibility where possible, or investing in family supportive policies, these are smart workforce strategies. They can help attract and retain talent, reduce absenteeism, and improve overall productivity. There's a clear role for the private sector in making this plan real. At the NC Chamber Foundation, we're committed to being a part of that effort. Over the past 3 years, our research and partnerships have increasingly focused on childcare access, housing, workforce participation, and the policies that support working families. And our findings reinforce that these are not just family challenges, they're economic imperatives. Consider these examples. First, our housing supply gap analysis and economic impact report showed a 489 billion potential economic activity if the housing needs are met over the next 5 years. Likewise, the child care shortage is costing North Carolina more than $5.6 billion in lost productivity and turnover. And the majority of those costs are hitting the bottom line of our job creators. I want to thank the NCIOM team and Ivana in particular for their partnership and leadership throughout this process. And thank you to the many cross-sector voices who informed and shaped this plan. It reflects deep listening, honest dialogue, and a shared commitment to North Carolina's future. So I'm excited for the discussion ahead today and look forward to hearing from our panelists on how this work is taking shape in the communities across our state. Thank you.
Thank you so much, Meredith. And those numbers are so important because it does affect business, it does affect families, and then it becomes cyclical. So the fact that we can help both sides of this recover and keep going is really important, I think, to the work that we are doing. So thank you. All right, so now we're going to do a report overview, and I'm going to go ahead and just take a few minutes of your time to discuss some of the level setting and then what the report actually did for us. So it's best to start by level setting, as I mentioned, on how certain terms were defined and used in the report. Per the CDC, ACEs, adverse childhood experiences, are preventable, potentially traumatic events that occur in childhood and adolescence, so 0 to 17 years. And then these ACEs include physical, emotional, and sexual abuse, witnessing violence in the home, having a family member die by suicide, separation of a child from their parents, and growing up in a household with substance use, mental health problems, or instability. As the number of ACEs experienced increases, so does risk for negative health outcomes. Factors that exacerbate the effects of ACEs include systemic racism, discrimination, multi-generational poverty, and socioeconomic conditions, such as living in under-resourced, racially segregated neighborhoods or experiencing food insecurity. Beyond ACEs, children can experience a wide range of other challenging situations that can negatively impact their development and well-being. These include financial hardships, discrimination, community violence, natural disasters, bullying, and more. Then, per the CDC, positive childhood experiences are experiences in childhood that provide children with safe, stable, nurturing, and equitable relationships and environments. So the examples, just a few of them, are close, nurturing relationships with parents, caregivers, peers, and others in their community, living in safe homes and communities, feeling safe at school, and having opportunities to learn and belong in a community. There are also other protective factors that support children's health, development, and well-being. So now we'll start digging into the report. The NCIOM 2015 Task Force report, which is why this was called an updated report, because it looked back on that report. The 2015 report focused on 4 key goals that were intended to establish a comprehensive statewide system supporting safe, stable, nurturing relationships and environments for all children. Together, these goals from 2015 formed the backbone for 15 recommendations and a coordinated long-term strategy to reduce child maltreatment and promote child and family well-being across North Carolina. So since 2015, we've seen some notable changes in perspective. For example, in the 2015 report, there's a focus on child maltreatment. While preventing this is still extremely important, we now recognize that there are many facets to adversity that can impact a child. For example, we now have evidence of the power of positive childhood experiences and their ability to mitigate the effects of ACEs. We've also seen the importance of building resilience, which can help buffer the negative effects of trauma and promote long-term health and well-being. Medicaid, the largest provider of insurance to children in the state, has been actively weaving trauma-informed principles into its system, emphasizing prevention, early intervention, and family-centered approaches. What stayed the same since 2015 is the importance of systemic collection of data to inform actions and the value of changing social norms to prevent childhood adversity and to increase positive experiences. So I just wanted to share some startling statistics that really help paint the picture of the cost of ACEs. So a child with an ACE score, and the traditional scoring method has up to 10, though now we know that adversity has a lot more than that. But with a child with an ACEs score of 4 or higher, 70% more likely to be an offender or a victim of a violent crime. North Carolina spends more than $4,000 a minute on the downstream consequences of child maltreatment. And as of 2023, it has cost North Carolina more than 119 billion, yes, billion, to investigate claims of child maltreatment. And this quote from Sharon Hirsch, President and CEO of Positive Childhood Alliance NC, really signifies a mind shift in the field and a lot of the strong data coming out. The absence of PCEs may be more damaging to long-term health outcomes than the presence of ACEs. So I really want us to sit and think about that, about how the absence of positive experiences can be more damaging than the ACEs. And so that's something we'll explore throughout the report as well. So speaking of the report itself is divided into 6 chapters. Chapters 2 through 6 provide recommendations based on the overarching topic of the chapter. Each chapter also provides an overview and level set of the topic before diving into the recommendations. So as I mentioned, 2015 had 15 recommendations. For this 2025 report, we revisited 7 priority recommendations. And many of the revisions were based on timeliness for context. So for example, as mentioned, the focus on ACEs being more than just child maltreatment. While the resulting updated recommendations may not share much with the original recommendation, they're certainly inspired by it. So I wanted to give this quick example. In 2015, the recommendation was to support the establishment and continuation of trauma-informed practices and communities. So all this is something we emphasize further in the report, but this particular recommendation, we realized it was important to focus on prevention. That is something the CDC likes us to do. That's something where we can see a lot of the cost-saving measures as well. So the changed recommendation involved having a working group being established by the DHHS to promote the incorporation of positive childhood experiences throughout state and local initiatives. And then we have 8 new recommendations in the report, as Meredith mentioned as well, for the total of 15 new recommendations. And it's important that I note that these recommendations are not simply crafted by NCIOM staff. They are consensus of the update committee. Each one is reviewed and agreed upon and is evidence-based. We do also want to tip our hats to the General Assembly for the work being done. For example, Senate Bill 412, which increased child care subsidy reimbursement rates statewide, with annual funds allocated to raise rates and other additional support in rural counties and for infant and toddler care. However, as the committee commenced, the update committee for this report, we realized that maybe we could do a little bit more for the subsidy rates. So one of our recommendations is to further increase those subsidy rates. Another recommendation we have is that child care workforce salaries should be increased and prioritized by using targeted investments to attract and retain skilled workers critical to delivering care. So, Essentials for Childhood Data to Action. A part of this was also that the CDC funding requires recipient states, such as North Carolina, to develop a surveillance system, which is a way to compile, routinely update, and monitor data on ACEs, PCEs, and social drivers of health. The compiled data can then be used to make data-driven decisions about the need to modify existing prevention strategies or develop new ones. And very importantly, to ensure that prevention is focused on communities and populations experiencing a high burden of ACEs or fewer PCEs. The system is being created in partnership by the epidemiology team led by Scott Prescher-Beld in the Division of Public Health Injury and Violence Prevention Branch, and researchers from the UNC Injury Prevention Research Center. The UNC lead is Dr. Megan Shanahan. Development of the system was also informed by a data development working group led by Dr. Shanahan, along with 19 other individuals who work directly with data sources or end users of the data. The working group met 3 times in September, October, and November of 2024. They worked to identify data sources and indicators for ACEs, PCEs, and social drivers of health, determine data access, and importantly, discussed how to decide when to take action based on what they were seeing from these indicators that they were following. The Essentials Childhood funding is slated to end in 2028. However, maintaining, updating, and using the data in the surveillance system will require ongoing resources and staffing. The updated Essentials Recommendation 12 calls on the North Carolina General Assembly to allocate funds to ensure sustainability of the surveillance system into the future. So that's a very quick rundown of the report, how it came about, and what it encompasses. We'll send a link for the report at the end of these slides as well. And with that, we'll move on to our panel discussion. So for our panel discussion, I would like to introduce them first. We have Jenna Barnes, Director, Early Childhood, Blue Cross and Blue Shield of North Carolina Foundation. We have Amy Cubbage, President, North Carolina Partnership for Children, and Kella Hatcher, Executive Director for the North Carolina Child Fatality Task Force. So thank you so much. Please help me welcome them, and I'm very excited to have them join us. I see Jenna and Amy. Now we see Kella Hatcher pinned as well, please. I want her to join the club. There we go. There are ladies. Perfect. So I'm going to start with a question for all three of you, and whomever would like to answer first, by all means, go ahead and jump in. The first question, in your work, how have you seen the field evolve in its approach to preventing child maltreatment and promoting child and family well-being, particularly as awareness of ACEs and PACEs has grown?
I'm happy to start, Ivana.
Thank you, Kella.
Sure. Many years ago, I was working in the state office of the Guardian Ad Litem program. And phrases like adverse childhood experiences and social determinants of health didn't really exist. Or if they did, they were certainly not part of the conversations of those working in the field of child welfare. And now, of course, those of us working at any field related to child well-being are familiar with the phrases and the related research, and it helps us understand and address the issues that impact child well-being. And now we've got the concept of positive childhood experiences. It's even newer and helping us do better in promoting child well-being. And when I came to the task force 10 years ago and was sort of bombarded by lots of public health terminology I wasn't very familiar with, these were some of the things I began to learn about and understand the importance of, and realizing that how much it would have helped had we been talking about these things many, many years ago.
Mm-hmm. Thank you, Kella.
I can pick up on something Kella mentioned, just about the increasing focus on positive childhood experiences. And I think that focus has really kind of shifted the field away from a deficit-focused framing to one that's more solutions-focused, that really points us more to what can we do about it. And I think this piece of the conversation really has the potential to mobilize action on what we can do and what we know works to support kids and families. I think in the philanthropic space, we've also seen an increasing number of funders across the country who are really focusing in on early relational health and who are thinking about strategies to promote safe, stable, and nurturing relationships. And we're also seeing an integration of conversations to think about this work more holistically. So not only about risk and protective factors, but really seeing the conversation kind of come together around the intersection of all of the issues that touch children and families, whether that's family economic security, maternal health, childcare, and early learning environments. So I think this has really spurred a lot of thinking in the sector, and something you see also reflected in this report about how we promote child and family well-being in a more integrated and multifaceted way.
That's wonderful. Thank you, Jenna.
And I would add into those great responses from Kella and Jenna. Work has evolved, I think, to have more of an authentic response to what it means to talk about families first, parental choice, that we focus in on the family and we support families. North Carolina was the first and oldest state in the country to say, as a state, we are going to first and foremost respect and undergird and uplift parents' role as the primary teachers of their young children birth to 5. And that is a wonderful pronouncement, and we've lived into it in many wonderful ways in North Carolina, but some of it's been lip service. Have we really said families first? What do families need? And I think that we're finally getting to that. I think this report uplifts that, and to really think about in the early childhood system that we're committed to being parental choice, private partnerships. How do we ensure there's true choice? So those families who need the supports of a formal child care center choose a family child care home for their young child, or may need supports to be a stay-at-home parent and make that choice for their family. Are we really saying all of those choices are absolutely equal? Are we treating families fairly in North Carolina to live into that commitment that we have in state legislation, again, to say families first, and the state of North Carolina has a role to play in supporting those families to live into that utmost, most important role. And I think we're starting to see some changes there, some innovation, some uplifting of the business sector's role to play in that, not only in formal early care and education, but also in other ways, the home visiting and healthcare, et cetera.
Wow. This is a powerful way to start this panel's discussion, ladies. Thank you so much. These are all great responses, and it shows the variety of things that we can do and have to continue to do to prevent child maltreatment and to help families and children in North Carolina. Next question I have is going to be directed at you, Amy. You touched on this just a little bit, but what's missing from the conversation at the state level that's critical from a community perspective?
Thanks, Ivana. Well, first, I want to take a moment to thank you very much for all the incredible work you have done. Ingrid, you as well, and NCIOM,
Thank you.
Meredith and Sharon as co-chairs of the committee of the Essentials for Childhood Update Committee, and NCPC and Smart Start. We're very honored to be a part of this work. I think it kind of flows from what I was just talking about with centering parents and families, but baked into the DNA of Smart Start is that communities first and communities know best, and that we need to elevate their fonts of wisdom. Those of us in Raleigh, our role is to listen, to respect, to elevate, but to understand really what that means and what is the difference between being an undergirding, supporting state agency, and what does it mean to be maybe an umbrella on this rainy day across North Carolina? Is that what families and parents and communities need, or do they need really that undergirding support, which I would posit they do, that's what communities are asking for. And that another area that I will elevate is how can state agencies dismantle local implementation barriers? So are there technology barriers getting in the way? Asking folks to do data collection, but they don't have the tools. They don't have the internet to access the portals and the time they may be spending to do that kind of work. How do we break down that kind of a barrier? Are communities finding that families don't have transportation to get to services and programs? And are we responding by purchasing mobile units, mobile preschools, mobile resource centers to go out to child care providers, respecting their time, knowing that they don't have time maybe to come to, as wonderful as they may be, a local Smart Start resource center or an R&R resource center in a community? How are we looking at always compensation? Like you put the wonderful slide up. I'm so proud to be on a committee that said compensation of the early childhood workforce is first and foremost. Challenge. It has been the greatest challenge. Pre-COVID, it was the greatest challenge. Post-Helene, it's the greatest challenge. That is our challenge. How are we going to ensure sustainable funding? And that when we talk about things like maybe an early childhood endowment in the state of North Carolina, are we saying those funds need to be first and foremost used for those who are doing the most direct service work, caring for young children or their families as family support workers, etc. And then I would also elevate how can we model at the state level cross-sector alignment? Are we doing that here? And then we can obviously support and help communities, often learn from them where they're collaborating across faith-based communities and healthcare and a local education agency and early care and education providers. And so I think ensuring those aspects come into our state level conversations is critically important. And I have great hope that the framework from the Essentials report will help us to do that more and better.
That's wonderful, Amy. Thank you so much. That was a very insightful response. I think that gave us a great action plan too of how we can continue to do this work. Kella, the next question is going to be for you. From your role with the Child Fatality Task Force, what connections do you see between that work and the goals outlined in this report, particularly around prevention, systems change, and child well-being?
Thanks for that question, Ivana. And I want to start by making sure that folks who are in the webinar at least have an idea that the Child Fatality Task Force, we're not a service-related organization, but we make policy recommendations and specifically changes in law and policy, and now for the for evidence-driven prevention strategies to prevent child deaths and promote child well-being. And we make those recommendations to the General Assembly, to the governor, and to other state leaders. And we've been doing that since 1991. So when we talk about connections between the work that we do on the task force and the goals in this report, I want to start with the topic of social norms that are addressed in this report. And that's sort of how the report starts, because the Child Fatality Task Force is actually part of the broader statewide child fatality prevention system. And this system also includes local child death review teams in every county that try to better understand child deaths and to identify and address system problems to prevent future deaths, as well as preventing child maltreatment. Now, the statutes that created this whole statewide system emphasize that the prevention of child maltreatment and child deaths is a community responsibility. And this Essentials report, in the discussion of social norms and elsewhere, highlights the need to get people to recognize these are community responsibilities, not just individual, not just one agency, not just one organization. It sounds to a lot of us like that's a no-brainer, but that concept, even in our statute, has been around for a very long time, and it's still something that needs to be emphasized over and over. And recognition of this community responsibility makes it more likely that someone not only recognizes a child or a family who's at risk and who needs to be connected to resources in their community, but also helps people recognize how much it truly matters to contribute to positive childhood experiences in their community. What can they do as individuals and organizations to make for an environment in their community by what they're doing in their organizations, in their volunteer opportunities, that really can make a difference in a child's life. Small things can make a big difference. Another way I see the connection between what we do and what's talked about in the report is the focus on financial stability and economic mobility and its importance in preventing child maltreatment. We have worked hard to educate our task force members on the ways that strategies that support economic stability prevent child maltreatment. I will say that's not always been easy. For example, there was a time when our discussions about paid family and medical leave insurance prompted a lot of pushback. Folks saying, how could this possibly have anything to do with child fatalities? But we've come a long way in really a short amount of time with those discussions. And in recent years, we've been able to continue studying that topic as more evidence emerges about its benefits to children, families, and employers, and not face the same kind of pushback. We've also been working on the childcare crisis and showing how a family's ability to access affordable, quality childcare isn't just a nice to have kind of thing. It actually impacts a child's risk of maltreatment and therefore child fatalities. So this report and the task force have really recognized there's a need to educate about this connection in order to see progress. And you can't just educate leaders, you have to educate the public as well, which is part of what this report talks about. And then finally, another connection that I think is important is that throughout this report, there's an emphasis on collecting and using data. The Child Fatality Task Force has long prided itself on using solid evidence and data to inform and drive its recommendations. Without solid data and evidence, it's hard to make an argument for why we need policy change or state or philanthropic funding, why it's so important. And it's hard to show the likelihood that a particular strategy or effort is going to have the desired positive impact. And so those are some areas, not the only areas, but those are some areas that I think are worth pointing out the connections. And we really applaud all the work that's gone into this. It's as though, you know, a lot of things that we talk about in the task force have been pulled together in one place and with a lot of great citations and footnotes, and that make a lot of the points that we end up making in our task force meetings. So we really do appreciate this work.
Thank you, Kella. And I love seeing the correlation between our work as well, because, you know, if you can't say it once, say it twice, you know, people will hear it even more, I think. And just knowing that we are both evidence-based, data-driven, that we have so much good data now that we can share with each other, and the fact that there is overlap is great. That means that, again, we're less siloed and we're able to do this work together. Jenna, I've got the next question for you. What opportunities do you see for philanthropy to support alignment, innovation, or accountability?
Thanks for that question. I think there's a lot of opportunities for philanthropy to plug in here. I mean, you've heard from many of our presenters here today that there's a big theme around reducing silos, coming together across sectors to make change that addresses a lot of the challenges facing North Carolina's children and families. Philanthropy can play an important role in being a connector and in fostering relationships between all of these stakeholders. So between public agencies, nonprofits, the business community, to really maximize impact and align resources. And funders can really do this through helping convene folks, making connections across work that we know is happening across the state, and also building capacity to enable collaboration. We know it takes dedicated staff time and resources for folks to come together, to convene, to collect data, to pilot and innovate. So that's certainly one way that philanthropy can support. I think on the innovation front, philanthropic dollars often provide more flexibility to pilot and test strategies that other sources of funding can't be used for or have more constraints around. And in this way, I think we can be really complementary to public investments by providing some of that flexibility that can make innovation possible. And I'll also say, we can think beyond grant dollars here to also consider how we as funders can really leverage our networks to bring in technical expertise and thought partnership and facilitate opportunities to learn from other states that can really also contribute to and support innovative thinking in our state. We've already talked a lot about data, data being a core component of the Essentials work, how important it is just in terms of decision making, informing implementation and tracking progress here. The report really outlines several opportunities for philanthropic support, whether that's around like an economic analysis or supporting like the overall data infrastructure that's really needed as part of that surveillance system that was mentioned at the beginning of the call. But finally, I think another key piece around accountability is really ensuring that we have parent and childcare provider voice as part of this ongoing work and conversation. And there are ways in which philanthropy can support opportunities for their meaningful involvement in the design, implementation, and evaluation of the recommendations as well as in uplifting policy and practice solutions that can drive long-term change. We know parents and childcare providers are very close to these issues, and they know the potential policy solutions that can move us forward.
Thank you so much, Jenna. And one thing I want to touch on that you said too is driving forward the voices of parents and providers. And I think that's so important. And we've heard that today from Kella and Amy too, is community, parents, providers, all these voices that need to be in the room together, I think is really important perspective. So thank you so much for that. Next question I have is again for all of you. So kind of looking forward. What's one action you would love to see taken in the next year as a result of this report? Kella, what if I start with you?
Sure. I think my answer builds on what I said earlier, and it's also pretty broad. But I think that I hope we can see progress with education that highlights the direct impact of financial stability on child and family well-being. And I think that too few people really understand the domino impact of a family's lack of financial stability, on many aspects of a child's well-being and the ways in which our community and state's decisions and many things surrounding that contribute. And the domino effect isn't just with that individual child and their family, it's also with the broader community. And so I do hope, I know this report talks about education, about helping people to understand that, but I think that's really important. And I would love to see that happen.
Wonderful. Thank you, Kella.
I'll go ahead if that's okay, Jenna. Thanks. I would, I think, just double down on the comments I made and that were reflected in what Jenna and Kella also said, and that is again the parent voice. And I think to what the wonderful comment from Lori in the chat is it just the usual suspects? How can we do better at bringing in those voices that have been left out of the picture? A commitment I have now, co-leading a new early childhood action plan on homelessness, is to elevate homelessness in every conversation. How in the world have I been in this field umpteen years, my whole profession, and as a child of a early care and education profession, not elevating homelessness and how are children, young children, impacted? We live in a country where you're most at risk during that first year of your life of eviction and homelessness. That needs to be spoken about and talked about, and we need to elevate it and have it be cross-sector, but also say, are those families here? Are those, again, is it just the usual suspects, whether it's the same community of parents we're talking to, or is it the same organizations that are coming to the table and always asking who's missing, who's left out, and centering that on a concept of fairness. That's not fair not to have folks at the table having access to these resources, to these conversations. And I think we all need to do better at that in early childhood. And again, this report, I commend it all to you to really dig into, because it has the steps in place to do that. And I think that even within a year, we can start to see that happening. The governor's task force, with the legislature's commitment, with an early childhood caucus, and with other organizations that are saying we must center families. And it's so bipartisan, right? We all are saying that. Nobody owns those words, just like we don't own the word of a patriot. We don't own, parental choice. My concept isn't better. We all can agree and believe in and live into families and parents first and foremost. Thanks.
Thank you, Amy.
I totally agree with Amy and Kella's comments, as well as specific opportunities. I think for me, I'd really love to see this report spur more collaboration to see some of these recommended working groups in the report come together and really think about moving this work forward with next steps. I think this report does such a great job of highlighting all of the work that's already happening in our state. I think we have so much that we can readily build on and knit together into something more comprehensive. And as Amy highlighted, there's already momentum around childcare and folks coming together to solve some of those challenges as well. I think everyone has a role to play to ensure North Carolina's families and children thrive. And I hope we can keep this conversation and momentum going.
Wonderful, thank you. Now, before I ask the final question of the three of you, I do want to point out that we do have the Q&A function. So if you have any questions for the panelists or any of the speakers today, feel free to drop the questions in the Q&A section of the bar down below. I'd love to hear from you folks. I see some great comments in the chat too. So, final question for all three of you, because I think that the three of you provide such great different perspectives. But what I'm hearing is it's a lot of the same overlapping stuff. And I mean that in the best way, is that shows there can be more cohesion and more working together, which can provide better results. So, the final question, what gives you hope as you think about the path ahead for North Carolina's children and families?
I'm happy to jump in, Ivana. Really, that there's no shortage of talented, committed people who care about these issues and who want to do something about them. My work with the task force involves people who have really big, important jobs. We're talking state agency leaders and, community leaders and state legislators. They've got these really big, important jobs, and they nevertheless find time to come to our meetings. They find time to have leadership positions in our committees. We have volunteer members who are experts in a certain area that the committee works on that come to these meetings, and they contribute their time and expertise to the work of preventing child deaths and supporting child well-being. In the 10 years that I've been doing this, I've really been blown away at how much expertise and dedication there is. And so that gives me hope.
That's fantastic. Thank you.
I think Kella said it best, but we truly have an incredible network of nonprofits, leaders, funders, policymakers in our state who are all really dedicated to ensuring children and families thrive. That definitely gives me hope. I've definitely seen momentum in our state over the past year. And I think just the fact that we had so many stakeholders contribute to this report and show up for this conversation today, like really speaks to the importance of these issues and how dedicated our state is to figuring it out together.
I think that's a great point, is we are seeing more voices. We are seeing more people involved in these conversations. We're seeing more people continue the work and look forward, but there's always room for more. There's room for more improvement. There's room for more voices. There's room for more from the General Assembly too. I know we all are trying to give them some evidence-based research that we think can help them look forward as well. So I think that we're doing such good work, and that the work I've seen out of the state just continues to really make us proud of what we can try to do for children and families in North Carolina. Brady, may I confirm with you that there are no questions in the chat?
I believe we have, let's see, one question in the chat, not in the Q&A.
Okay, thank you. I think it's the last comment, correct?
Yes.
All right, so since we have a minute, I'm going to throw the three of you a wrench. Let's see how quick you are. It's a comment from Lori, if you want to read it as well, and I'll read it out loud. We also need to take a look at those complex public systems and be open to change. As a fan of complexity, I often find public systems are complicated, not complex. How can we examine and change those systems in the public interest?
I can go ahead and give it a shot. I appreciate this question, Lori, and think you're right to point out the difference between complexity and complicated. And the complications, I think, come in when we are being overly burdensome, when we are asking organizations or individuals to engage in multiple reporting or funding and duplication of those efforts for data, that needs to be streamlined, that we need to commit to every recipient of a service, every family need not know where that funding is coming from. Every teacher getting professional development or technical assistance doesn't need to know where the funding's coming from, but that it's aligned and streamlined, whether they're speaking to a child care health consultant or another coach on teacher-child interactions, that they're speaking the same language. We have similar expectations for the competencies and qualifications of individuals that interact with young children and their families, so that stressor that can really add stress and complicate lives that are complex can become streamlined, smooth, and more efficient.
It's a wonderful answer, Amy. Thank you. Keller or Jenna, would you like to add anything? You're not required to.
I'll maybe just add, I mean, I definitely think what Amy said about the opportunity to kind of align and streamline systems is a real one to take a look at. But I also think this goes back to the role of data and thinking about what's working and what's not in our system and how that can help us take a look at, some of the complicated, complex pieces of the system and where there are opportunities to streamline to really drive more impact. So just want to drive it back to the data conversation.
Wonderful. Thank you. Great. Well, I think then I'm going to share my screen one more time and we're going to close out this webinar. Thank you all so much, presenters. You were panelists, you were fantastic, and the type of engaging conversation I absolutely knew we would get from you. So we are just going to move to closing and next steps. And I would love to take a second to thank Meredith Archie and Sharon Hirsch, who was unable to join us today, the co-chairs for this committee. They did such a great job leading the group, helping with the report, helping guide the building of the steering committee and then the update committee and getting all the voices in the room. And we could not have done that work without them. And a huge thank you to everyone who was on the steering committee and the update committee as well. We had about 10 steering committee members, 35 update committee members, plus our co-chairs. So even with a lot of voices in the room, the voices in the room were saying the same thing. So that was very promising. So a huge thank you, lastly, to Jenna, Amy, and Kella for joining us on the panel and sharing their thoughts. Also, thank you to all of you for joining us today. We really hope that the Essentials for Childhood Updated Action Plan can provide you with some new ideas and help you revisit and revitalize the previous work that may align with the recommendations. We also hope that you may have ideas on partnerships and whether they are new partnerships or strengthening old ones. So when you receive these slides, you'll have the link to the report, and you'll also have contact for both Ingrid and myself, who were kind of the backbones for getting this report together. And we couldn't have done it again without the committee who helped form these recommendations and who did all of the work to come up with this great plan. And be sure to reach out with any questions you have. And thank you again. And I hope you all have a wonderful, wonderful day. And don't be afraid to share this report with your friends either. Thank you so much, folks. Have a good one. Bye-bye.